Welcome to Sports Doc Talk. I'm Will Sanchez, along with our orthopedic surgeon and sports medicine specialist. Say that a bunch of times, Dr. Grant Garcia. Dr. Garcia, look, man, I don't know if you can see, man. I'm hanging with my nomies because it's the holiday season. I
That's
know we're going
right.
to talk about our injury spotlight, but I can't believe it's the end of the year, and it's been a great year. I want to throw that out there. It's always a pleasure working with you and doing these shows. So, how are you?
I'm good. No, it's end of the year. End of the year for some people is like, oh, Christmas is coming. End of the year for me means that I work as many days of the week as possible because deductible season is not done until December 31st. January, though, is great. January is usually a lot chiller.
That's a lot chiller. So can you get a T-shirt that says, Mr. Deductible or
uh,
something like that? Like
well,
and just wear it in December, or
I
is
don't
that
want
a
to
little
make it
bit?
about the deductible, but patients come in just absolutely begging to get it done. They're like, I've had my fair surgeries. My family's had their surgeries. Now it's free. So I want to do it now. Because
Nice.
in January it's not. And I'm like, okay, well, unfortunately we waited all year to decide on this, but nonetheless, we got to get them done. So we're going to stay busy, but we still have time for the podcast because we have way too much fun on this show.
We
So I'm
have
not going to miss the opportunity.
way too much fun. Listen, I see you have your Miami Dolphins background. And wait, and before that, let's give a little love to our peeps out here. Because when we're trying to recovery, where do you need to go? The recovery shop.
Recovery
Dr.
shop.
Garcia, tell us about the
So
recovery shop.
big thanks to our sponsors. We've had this, repeatedly on here. They've been great sponsors of the show, and I love talking about them. I mean, it keeps coming up with my patients, right? So
Yeah.
your patients, they get high quality surgery. They expect the best, and they after surgery, they're like, "What else can I do?" Right? Like,
Mm-hmm.
I got this surgery. You talked about all these fancy things. You talked on this show, internal bracing, you name it. But I want to make sure that I have the best recovery. So on there, we have nutrition supplementation, which is all over the internet and one of the hottest topics. We have the nice machine. We have new braces. We have the Rebliss for some of the patients who are kind of the more complicated knee
That's
surgeries.
pretty cool.
Yeah, and the
Yeah.
patients can get this, and it's easy. The patients have been thrilled with it. I mean, we have patients that had issues with snowstorm deliveries, and they made sure that they overnighted these products for them. And my patients love it. Again, there's no cut from me for you signing up for this. The key here is just to give information for surgeons or patients. If you did a surgery done and you want something like this, talk to your surgeon about using this opportunity because it's a really nice opportunity. It's beneficial for all parties. And again, the goal is for the patients to get the best. And sometimes it's hard to get the best with just insurance alone. So this opportunity is great. Reach out to Mike at recoveryshop.com. He's all over the website. Fantastic group to work with. Strongly recommend it for any surgeon who wants to offer patients a little bit extra. So thanks, guys.
Yeah, once again, Mike B at shop-recovery.com for more information. And that's what we're doing here today, right? We're providing everyone with a little bit more information. We were watching, NFL Sunday, right? NFL football. There's only so many weeks left. It's a sport that we love, that we're into, but we also know it's a sport that is dangerous, that we have severe injuries in there. And unfortunately, once again, a Miami Dolphin has sustained a concussion. Mike DuBose, catching the pass across the middle, getting hit, and pretty much laying there. Obviously, there was a lot of concern. And as the doctors that go out there, and we think about these head injuries, right? And you're like, okay, well, he got hurt. There's a head injury. Unless it's super, super serious, we usually don't see the cart or stretcher being, called out. They go into the blue tent, then eventually maybe get, back into the locker room, things like that. But for this situation, that wasn't the case. So they came out and they brought out the spine, the boarding. So why don't we wanted to talk about the importance of spine boarding in these situations. So why don't we start with there? And Dr. Garcia, just explain a little bit, like what's that procedure, right? You have the player there, you have concern, and we don't really think about spine boarding when we think of concussions. So tell us a little bit about what happened and how did they get there?
Yeah, so I mean, you can watch the videos. It was pretty atrocious looking in terms of the hit. You see the head cocked back. And then you see him go down and you see a postural position, and then you see very limited movement of the arms. Now, again, this is just what they're showing, right? They pull away from the athlete once they're
Yeah.
injured,
Yeah.
and then the medical team comes in. So we're not really getting to see that much. But from someone who's recently had to spine board a patient on the field, I can tell you that you don't just start pulling the spine board out just for fun.
Mhm.
Right? It's a pretty serious situation you're concerned about. I will tell you, this is like, when in doubt, spine board. Okay, so that's the number one thing I'm going to tell you. It's just like when you learn in lifeguarding, right? I was a lifeguard when I was a kid. If you're concerned about, again, they were not initially concerned about a head injury. I'm sure they were, but that's not why they spine boarded him. They spine boarded him because they're worried about a neck injury, and they're worried about a spine injury. So the board is for the spine to keep it straight. So really what the key is if you think there's damage to the spine, either the bones or the spinal cord, which we've all talked about, those are the
Yep.
worst possible football injuries we can think of. You don't want any movement of that spine. So you need this board to be on there, and then you need to be able to find a way to strap them on there. Now, this sounds really simple, right? You slide the board on, move them. It's not so simple to move a 240, 250-pound human being who is completely gone limp or is not moving, whether or not they have a real injury, and actually get them on the board. So there's actually a procedure, and you've seen, I will give you an example. So I take care of a high school team, right? Mercer High School. I've been there now for 6 years. We've had injuries on the field. And in one game, I had to spine board 2 players.
Jeez.
It is no joke. It's a traumatic thing for the players. It's very traumatic for the field. Obviously, the worst is for the player.
The parents also, right? The
And
parents,
for the
family, friends.
parents, for the other players, and for the stands. I mean, as soon as I spine board these patients, there was concerns of the players that died. There was concerns of the players were permanently paralyzed. And but you have to do it, right? Because you're concerned about it. So in both those cases, the players were not moving their legs or said they had severe back pain and they couldn't move. So you have to spine board them. So that's the same thing that happened here. Thankfully, in mine, both players were okay. And I will tell you that probably a majority of the time that we spine board, the player or person is okay. But there are definitely instances where it's not. We've seen this on the news. We've talked about this before with players getting paralyzed. But here, they thought there was something wrong with the cervical spine. And so they're going to spine board. The key is you imagine when you're rolling somebody, their whole thing is they're going to hold collapse, right? So you got to keep them on. But now the catch is here. He's also got a helmet on. So how do you get the helmet on without bending the neck or extending the neck?
Yeah.
Okay, that's the first part. So they have to take off the face shield, which they did.
Yep.
Right. That's so they can see, make sure he's breathing. Sometimes they have to take off the guard in the actual helmet.
Yep.
And sometimes you have to sneak in there. The other thing is you want to keep the airway open. So if they're worried he can't breathe, they're going to have to elevate the chin so that he can breathe and put a mask on him. And I know they brought out the oxygen for this as well.
Yeah.
So this is not a joke. This is not an exercise.
Yeah. Yeah. And they also hooked him up to EKG. So he was hooked up to EKG. And I'm obviously, I do not have the experience you do. I do have my certification, WFR, and the wilderness certification, and talking about how you're stabilizing. You have that person right behind the head, behind them, and stabilizing the neck. And they're like, do not let go of that head.
And you are like in charge.
Head. Yeah.
Like you are the most important person. So our average number of people for a spine boarding is 5. So when I did it, we had 5 EMTs and 2 surgeons there. Turns out my buddy, Dr. Wayne Wow, was also on the field. We had to do it together. But you get in there, players either not conscious and or players can't speak right and or player says they have numbness and tingling or back pain. The first thing you're going to do is check it out. The second thing you're going to do is if you're really worried, you're going to put them on the spine board and you're going to take them away to the hospital. And the reason is you want to get that CT scan, the CAT scan of their neck and spine to double check for any breaks. If they have to do an urgent MRI, they will. Many times on the way to the hospital, the decrease in anxiety for the player, the calm situation of being on the spine board, and or the amount of time from the injury, most of the time the real symptoms will either subside or still be there, right? So that's the biggest concern. There were some other things that you mentioned when you initially texted me yesterday about this injury that's pretty alarming for the people watching. It's cutting off all the pads, right? You don't get to see that often either. Like how often do you see a player leave with no shirt on? right?
Yeah, I
Other
thought
than
it
somebody.
was something else. I was like, "Oh my god, are we, we dealing with something, a Damar Hamlin situation, right?" And I'm gonna tease an episode that's gonna be out in about another month or so with us and Dr. Dave. And Dr. Dave was concerned not only about the heart, but maybe this was more of a traumatic injury to the brain. Anyway, I digress
And
a little bit.
this, you don't digress though, because you're right. This is a similar situation. So he had an EKG tested, maybe for arrhythmia issues when he got hit.
Mhm.
Similar thing to Damar Hamlin. He had the spine. So the reason they cut off the pads is so we can check the back of the neck, and they can check the back of the player, because you want it. The first thing you do is the back of the spine has a lot of points on it, and you want to feel those points, because if any of those are tender, there's a concern that something called a burst fracture, which is not good. But basically, it means that the spine is like a hole in it, right? So your cord can go through there and then surrounds by bone. When you have a burst fracture
Yeah.
or crack, you can have a crack and it can go into the spinal cord, or it can be unstable, and that can cause a shift, which could cause spinal cord damage. So that's why we're checking for that. And so all those things are important. So when I did one of these players, he kept complaining that I was hurting his back when I was touching him. And I'm not touching the muscles, I'm touching right on the bones. That to
Yeah.
me is spine board. Don't, get them over there,
Yeah.
do all this stuff. Like, so they probably checked his hands. They probably checked some stuff, and he's like, I can't feel my fingers, right? Because he had just gotten hit. So he's just totally out of it.
Yeah.
He may not even have been conscious. He may have not been able to say anything. He may have been limp and completely knocked out, right?
Oh,
He's on an
that's what
EKG.
it looks like. He did not look there was that slight movement, but it looked like, that could be also from the falling and your
Well,
body
he
still
he
kind of.
basically got he basically got KO'd,
Yeah.
boxing style. That's essentially what happened. Um, and so, they don't know what to do with this right now. So this is a split second decision. And I think that the part that I really like about this is that this was the safest bet to do. And when in doubt, you do that. So let's say you've taken your helmet off. Now you're starting to get off the head. Now again, the hardest part's the roll, right? You have 5 people. You need to roll a 250-pound monster. I mean, the kid I did was about the same size as him. So I don't
Yeah.
understand. It's not easy. You roll them off, you slide the pads out, you're getting the back feeling, and then you're putting them back on the board. And then you got to slide them onto the board. Now, again, none of this, you want any movement of the spine. So it's a lot harder than it sounds. And it's good to have a concerted effort. But it's amazing when you get a team that, we had 4 EMTs. So they were just like boom, 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 boom. And they took over in terms of how to move. Like, these guys just do this all the time, and they're really
Yeah.
good at it. And that's essentially what I mean, the team physician wasn't leading the spine boarding. That was the ATCs on the field
Yeah.
and
Yeah.
the
Yeah.
EMTs
I
that were
got it.
there to do that. So
Got it. The team physician would go with them. Is that something, when he gets in the ambulance, or is his responsibility to stay with the team and somebody else from the team goes with them and reports back of what's happening? What's normally that
that's
process?
That's an excellent question, because that is brought up a lot. And that's really hard when you start to be a team physician. You don't really understand like where your place is, right? Like, as a doctor, if I'm like doing surgery, I would never like leave my patient, right, and go somewhere else.
Yeah.
But at the same point, you have to, because your job is to, because after that play's done
He's
and
got
the player
52
goes
other
away,
guys, right?
yeah, or you have all the entire field you have to take care of. So
Yeah.
as a team physician, what you do is you pass it off. So you're basically, the EMTs go there, and like the same thing happened to me when I'm in the high school game, right? Like, I'm like, okay, send the player to the hospital, and then I will, if there's an update, they'll have my number, they can call me. Usually the trainers will update me as to what's going on. But once they're kind of at the hospital, they've got the appropriate emergency room care. So the same thing happened there. They probably called, had the hospital get ready. Then he went straight to the emergency room. He probably had all the testing done. And it sounds like he's doing really well. So this is really good news. Obviously, Will brought up at the beginning, head injury. But if we had had this discussion last night, that's not what we've been talking about, because
Correct.
this is new information
Yeah.
from the last 24 hours. But it's important for you guys, the listeners, to hear this, because this is not just orthopedics, this is team physician. And any surgeon or person, resident, ATC that takes care of the team physician, you need to know how to spine board, and you need to know the threshold to do it. And like I said, I've been covering these games for 6 years plus fellowship plus residency, and I've only had a spine board a couple times. But when it happens, you got to make the decision, and you
Is
got
it
to do what's
becoming
best
more
for the
than
player.
is it becoming more the norm? Because, we we see it more now. So I wonder what's the standard? What are those conversations? We know, especially at the high levels, I'm pretty sure in NFL, college, high school, you're involved with high school. You have these conversations, especially in the off season or going into a new season, saying, hey, when we have these type of injuries, we're always going to caution on the safer side because we're seeing players treated in this manner. It's not going back to like the Dennis Bird days where they're just laying there and it seems like people are not sure what to do. And, now it seems like there's a plan. What's that checkpoint system, right? You mentioned,
Yeah.
do you have feel in your hands? What's that process when you're going there and you're saying, oh, wait a minute, I see one sign and let's do this.
Yeah. So obviously there's the big red flags, which we talked about.
Yeah.
There's the consciousness, things like that. So obviously those have not changed, right? Like what you look for has not changed in the last 20 years. But what has changed is technology, information, social media, right? Like if there's a delayed response on the field, that doesn't look good for anybody,
Yeah.
right? It's just serious. We don't know. I don't think of, and again, I hope, obviously this is just my opinion or what I've seen. So this is definitely not 100. This definitely hasn't been fact checked,
Yeah.
but I haven't seen an increase in issues with delayed responses from the NFL, right? We haven't seen a herd of players that have had that have died. They weren't taken care of. I mean, if anything, we talked about Damari Hamlin is like a stroke of pure amazement that they were able to get on the field that fast and take care of that. So, and nothing but accolades for all the secondary, the EMTs and everything else and the ATCs on the field. So what I have seen is probably an increased response time, like you said. So there's just more speed to get there. And probably from Damari Hamlin and we talked about this with Dr. Joe Liu, the entire team probably does extra checks. And I would imagine from some of these more serious injuries, Bronny, Damari Hamlin, and other players that we've seen, that there are probably an increase in what they're going to start doing stuff. And we've seen really bad injuries and everybody knows that like sometimes response time is really important with any of these things. So we just probably seen, and we're also now looking for it more, Will, but I would say that
good point.
I do think that that the checklist for these injuries has probably increased. And there is, with litigation increasing, with NFL lawsuits, which we talked about with Dr. Liu, there is no doubt in my mind that all of that has helped persuade people to do things a little bit more aggressively.
Caution, right? I mean, it's just making sure that if you're going to side anyway in any direction, you're siding in an area that's just being extra cautious, right?
Well, if there's ever a doubt, you spine board. There's just there's no one. I mean, I had a patient I thought had broken their neck on one of my teams and tons of pain in the back of the neck. The dad was an orthopedic surgeon. I don't think he was going to be very happy to me that I sent his son to the emergency room to get a CT scan, but I didn't really care, right? Because I'm like, I don't really care what the dad thinks. I don't care what anybody else thinks. It's going to be a nuisance. They're going to get called at 2 a.m. because they have their CT scan of their son back. But to me, all I care about is that I'm making sure that the player is fine. And they ended up being fine, which was great. But what is the number? One miss over 100 non-misses is well worth it still. So again, I'm not spine boarding everyone on the field. Like I told you before, it's very rare that I have to do it, but there was enough that you had these team physicians calling for it. So anyhow, I mean, we could go ad nauseum with this, but again, the importance here is understanding that this was clearly more serious. They expected it to be more serious, and thank goodness it's not. And hopefully he has a full recovery and this goes in a concussion protocol, and in a few weeks he's back to playing.
Yeah, and for me, it's the evolution. That's what stands out for me, because I was like, wait a minute, this was head trauma, right? It wasn't, I can't feel my legs or anything like that. So just seeing the evolution of how players are being treated and taken care of, and you illustrated perfectly, especially what has happened since Damar Hamlin. And I can imagine those conversations you're starting the day after with every team physician, with those type of scenarios, is just being overly cautious and just being careful and making sure that, because that's the scariest thing that anything can happen to the NFL, right? Is having a player, God forbid, die on the field. and all of a sudden, moms and dads all over the place are saying, "Well, go make Juan Soto money and go play baseball and get off the football field." And just real quick, you mentioned that you do work with Mercer Island. At one point, I was one of the coaches with Franklin High School, and we had a player that got absolutely demolished on the field on a kickoff return. And we had to call the ambulance. They had to get spine boarded, and they wound up going to Harborview. All of us, I can't imagine the parents and everyone else in the stands, as you mentioned, but from the coaching staff, we were playing against Hale. From the coaching staff, I just wanted the game to be over.
Well,
I
they
wanted,
canceled our game. The game got forfeited when we did it.
yeah,
It was so traumatic for people that the entire game was forfeited.
yeah, I kind of wish that we would have done the same thing, right? I wasn't a head coach, but it's one of those things like all I want to do was get out of there, get in my car, and then myself and the head coach, we went to the hospital, checked in on them, got the update. The parents were there, and and then once we were all done, we were like, I was looking at the coach, I was like, well, let's go get a slice of pizza and a beer. I need a sec. I can't go home right now. I need a second. So it is just so scary to see anyone so vulnerable. So one of the reasons also that we were kind of talking about this as well.
No, and it's good. I mean, it's just important for people to understand that. I'm glad it was taken seriously. This is important for people to understand when you see the spine board come out. It's again the goal of this episode, I think, is, and again, we're not going to run on too much longer, but the goal of the episode is to show people that it's when you see a spine board, it doesn't mean there's some catastrophic thing. We don't want to cause more trauma to people when they see the spine board come out. But I want you also to hear that it's expected that you should feel trauma. Like, to see the spine board is very traumatic. Like the traumatic response I got when I got home, my wife was telling me, I saw the Instagram post about what happened at your game. What happened? And I hadn't even been home yet. It was like 1 hour.
Yeah,
right. And it was a lot of traumatic, and they canceled the game and everything else. So that's totally an expected response. But at the same point it's also doctors and EMTs just doing their job because we want to be safe. So a lot of times it isn't as big a deal. But to understand that, the number one thing you should think about is obviously the safety of the player. And two, just making sure that it's good to know that people are on the field that want to make sure the player gets the safest, most lowest risk potential scenario. So.
Yeah. Hey, look at this picture over here. Look at that. Sportsdoctalk.com. All sports, all orthopedics, all the time. Check out our website. You get look at this guy right here. Look at that picture. I mean, what a
I'm gonna
ham.
have to change that to your picture. I got that the greatest picture ever in the logo
What
of
a
you.
ham. Yeah, check out our past episodes, our transcripts. We always want to hear from you. So if you have some suggestions for shows, we've had a couple people request certain shows, and we make sure that we give our listeners what they want, especially being informative. So we want to hear from you, but please check out the website, check out our podcast. We have audio podcasts, video podcasts on YouTube. We're on every streaming platform: Spotify, iHeart, Apple, you name it, we're there. You're probably sick of us at that point, but we really appreciate you, because you know what? I'm hanging with my nomies right here, and this is my nomie right here with me, Dr. Grant Garcia. Happy holidays. You're all squared away for the holidays and ready to go, except for the 18 surgeries you're doing in the next 2 days. Is that
Yeah, we're good. I listen, that's why I have a great wife, because I can do my job and she's gonna take care of all the stuff. She's gonna take care of everything that's actually important, and I'm just gonna focus on doing my stuff. So anyhow, I appreciate all you listeners. Happy holidays. This is gonna be the last episode of the new year, but we've got a lot more to come, and I'm really looking forward to next year. And we've seen a lot of changes in this podcast. We've got these injury updates, we got guest appearances. It's been awesome, and I think the viewers like all of it. So, I mean, I just heard about. I was telling Will, I heard a couple patients even this week asking about the podcast and things that they had seen about it. So we keep doing this so you guys can be informed. This is fun for us. This is not our full-time job. So this is just something we just record late at night.
It's spooky. Anyway, happy holidays, everyone. We want to wish everyone a Merry Christmas, Hanukkah, however you celebrate with your loved ones. Happy New Year, and be merry and be safe. Dr. Garcia, I appreciate our relationship, our friendship,
Me too.
and our partnership. So let's keep it going.
My Nomi.
My no me. Bye, peoples.